Hi there, in this video I'm going to show you some simple home remedies that you can use to UTI without antibiotics. These remedies are all natural and easy to follow, so stick around and I'll show them to you right now. A urinary tract infection, UTI, is an umbrella term for infections of the upper urinary tract, which may include the kidneys, pyelonephritis, as well as infections of the lower urinary tract, which may include the bladder, cystitis. The term UTI is most usually used interchangeably with infections of the lower urinary tract that typically cause mild to moderate pain or discomfort. While pharmaceuticals can swiftly treat UTIs, many people get relief from their UTI symptoms by using home remedies. Let's look at some of the most popular UTI home treatments. Correctly wipe. Staying as clean and dry as possible is one of the greatest ways to prevent UTIs at home. Wiping from front to back after peeing or having a bowel movement is considered good hygiene because it prevents bacteria from entering the urethra and migrating up the urinary tract. Put on cotton underwear. Wear natural fiber underwear to keep the urethra as clean and dry as possible to prevent bacterial entry. Clothing that is overly tight can restrict airflow to the urethra. Without airflow, bacteria can enter and create an environment conducive to the development of a UTI. Clothing composed of synthetic fibers, such as nylon, can retain moisture, allowing bacteria to develop. Don't be a jerk. The presence of bacteria in the urinary system does not imply infection. Good bacteria is present and vital for maintaining a healthy balance. Douching can kill good bacteria as well as bad germs and disrupt your body's pH equilibrium. This may eventually allow bad microorganisms to thrive. The vaginal discharge cleans itself. If you must wash your hands down there, choose a pH-balanced solution, such as Summer's Eve. Change soaps. UTIs could be caused by your bubble bath, body wash, and other cleaning goods. Use dye and fragrance-free sensitive formulations. Change menstrual pads, tampons, or cups on a regular basis. Synthetic low absorbency pads might expose your vulva to microorganisms and increase your risk of infection. Tampons might promote bacteria to multiply faster, thus it's critical to change your tampons on a regular basis. Tampons and menstrual cups may raise your chances of acquiring or aggravating a UTI if not used properly. Bacteria can spread to the bladder if it pulls on your urethra and traps your pee. Changing the size or form of a menstrual cup may aid in the prevention of recurrent UTIs. Avoid using spermicides. Spermicide is a type of birth control in which sperm is killed by inserting a device into the vagina before sex. Spermicides may cause irritation by reducing natural barriers to bacterial invasion and ultimately infection. It is advised to avoid spermicides while suffering from a UTI. Urinating before and immediately after intercourse can also help avoid UTIs. Make use of heat. A UTI can cause pain or discomfort in the pubic area. Heating pads or hot water bottles, which are simple to use, can help relieve discomfort in that area. Heat applied to the pelvic area for around 15 minutes can make a significant improvement. To avoid irritation or burning, make sure the temperature isn't too high and that the heat source isn't too close to the skin. While taking a warm bath may appear to be a sensible treatment to UTI pain, most healthcare professionals advise against it. If you must take a bath, skip the soap and suds and restrict your soak duration. Hydrate. Drinking enough of water is one of the most effective home treatments for UTIs. Drinking enough of water aids in the removal of microorganisms from the body. According to Harvard Health, the average healthy person should drink 4 to 6 cups of water every day. 9th. Consume cranberry juice. A urinary tract infection can occur when bacteria bind to cell walls in the urinary tract. The main element in cranberry juice, proanthocyanidins, can help inhibit bacteria from sticking to urinary tract walls, potentially preventing UTIs. According to a National Center for Biotechnology information study, cranberry juice minimizes the number of UTIs a person can develop over the course of a year. In addition to cranberry juice, various over-the-counter cranberry pills have the same purpose. The use of unsweetened cranberry juice to treat UTIs is hotly discussed among doctors. While drinking the juice may benefit some people, it may not benefit others. It is ultimately up to each individual to decide whether or not cranberry juice should be used to treat UTIs. Urinate frequently. Urinating frequently while suffering from a UTI will help flush bacteria from the urethra. Resisting the desire to pee can keep bacteria from urine locked in the bladder, potentially worsening UTIs. Urinating before and after sexual contact reduces the number of bacteria that enters the urethra. Consume more garlic. Garlic is widely known for its antibacterial and antifungal properties, and it is a wonderful method to improve your immune system. Allicin, one of the chemicals found in garlic, has antibacterial characteristics that have been shown to be efficient in killing E. coli. Consume less sugar. Because UTI is caused by a bacterial infection, diet can be quite important in preventing it, explains Sarah Emily Sajdak, DAOM, a doctor of acupuncture and traditional Chinese medicine in New York City. Because bacteria love sugar, the more sugar you consume, the more you fuel the infection.